Hello. In our study, we evaluated four different mathematical models or mathematical functions for diffusion-weighted imaging signal decay of prostate cancer. Prostate cancer continues to be most common cancer in Western world and is the second most common cause of death in men. Diffusion-weighted imaging was shown to be particularly valuable not only for prostate cancer detection but also prostate cancer characterization. Previous studies have demonstrated that the signal decay obtained using diffusion-weighted imaging and b-values up to 2000 or even up to 3000 is better described by Kurtoz's third exponential v exponential models, respectively functions, in healthy prostate but also in prostate cancer. In our previous study, we evaluated these four models in terms of how well the model fits to data and also how robust are the parameters, either using simulations or using repeated measurements. However, in the current study, we aim to evaluate the repeatability of the fitted parameters in a larger patient population and also to answer ultimately the most important question for the clinicians, if these parameters provide some useful information or do the parameters of more complex model provide information on top of the more simple mono-exponential model. Thus, this study has two aims. One, to evaluate the repeatability of the fitted parameter, and second, to evaluate the clinical performance of these fitted parameters on the region of interest level. Diffusion-weighted imaging was performed using 3T MR scanner and spin-echo single-shot EPI sequence using monopolar diffusion gradient scheme. Imaging parameters are shown on the slide. In-plane resolution was 2.5 mm, slice thickness was 5 mm. We used 12 B values from 0 to 2000 and diffusion time was 20.3 milliseconds. The analyses were performed region of interest level, a squared shaped ROI of 25 voxels, which is the size of 5.6 times 5.6 times 5 millimeter, was placed in the center of prostate cancer area, and then the same size ROI in the contralateral zone not containing prostate cancer. The first row is the first repetition, second row is second repetition. B and F are B0 and CG are B2000, while the situated image H is a whole mount prostate section where cancer is outlined in green. We used four mathematical models or mathematical functions. We used mono-exponential model, Kurtosis model, stretch exponential model, and B-exponential model. The signal was normalized to B0, resulting into one parameter for mono-exponential, two parameters for Kurtosis, two parameters stretch exponential, and three parameters for B-exponential model respect function. Fitting was performed using LM algorithm in Python programming language. Specifically, we use least square bound SciPy library, which is a wrapper for Fortran Minipeg library. Multiple initialization in the gridding search were used to limit possible effect of local minima. The fitting code, but also the post-processing code is freely available on the following address. Prostate cancer detection and also prostate cancer characterization was evaluated using AUC values. AUC values for differentiation of prostate cancer from normal tissue, but also for prostate cancer with lower Gleason score from those with higher Gleason score. Gleason score is a histopathological marker of prostate cancer aggressiveness. Similarly, we also used Spearman correlation coefficient with Gleason score groups of tumors with 3+3, 3+4, and higher than 3+4. Repeatability was evaluated using coefficient of repeatability and intra-class correlation coefficient. Intra-class correlation coefficient, differences between the repeated measurements are compared to differences between the subjects. In total, we enrolled 55 patients, but 5 were excluded either due to motion artifact or susceptibility artifact. 50 patients were included in final analysis, and median range for age and serum prostate-specific antigen are shown on the slide. In total, 118 ROIs were placed, 75% of these in peripheral zone, while 25% in the central gland. Table 1 in the manuscript show median and 95 confidence interval values of all fitted parameters, of all 8 fitted parameters, either in normal tissue or in low Gleason score group, which is 3+3 tumors, intermediate Gleason score groups, which are 3+4, and high Gleason score groups, which are these most aggressive tumors, which are higher than 3+4. When you look at the AUC values, there are no major differences in AUC values between ADC parameters, either from the mono-exponential model, kurtosis, or stretch exponential model, and also K parameter of the kurtosis model performs similar as the ADC parameters. However, the alpha parameter of the stretch exponential and the parameter of B exponential model perform lower, either in terms of prostate cancer differentiation from normal tissue or in terms of prostate cancer characterization, meaning differentiation of low Gleason score tumors from those with higher Gleason score. And this was present also in the peripheral zone tumors, but also in the central gland tumors. So there was no differences in terms of zonal performance for these parameters. When we look at the Spearman correlation coefficient, again, the ADC parameters, either from the mono-exponential, kurtosis, or stretch exponential, were performing similarly, and also in the central gland, also in the peripheral zone, while the alpha parameter of the stretch exponential and all parameters of B exponential model performed lower in terms of absolute Spearman correlation values. Repeatability, as said, was about using coefficient of repeatability and IC31 values. Mono-exponential model performed robust repeatability, relatively low coefficient of repeatability values expressed as percentage of median, around 20%, and they are similar in the peripheral zone but also in the central gland otherwise. And these values are similar to the ADCK, K, and ADCS. ADCS is from the stretch exponential, while the other two parameters were from the kurtosis model. In contrast, other parameters demonstrated lower repeatability, meaning higher coefficient of repeatability values or lower IC31. The coefficient of repeatability values for alpha parameter were relatively low, but this needs to be interpreted in conjunction with IC3.1 values, because there were small differences between the repetitions but also between the subjects for alpha parameter. So in conclusion, the parameters of the kurtosis, stretch exponential, B exponential parameters derived using region of interest based analysis did not outperform the mono-exponential parameter in terms of prostate cancer detection, prostate cancer characterization, and demonstrated lower repeatability compared to the parameters of mono-exponential models.